In World War II, the army had a secret rule. Black nurses were good enough to treat Nazi prisoners, but not white GIs. They rejected 9,000 qualified black women until one dared to ask why. February 27, 1890. The Caribbean island of Barbados. A girl named Mabel Doyle entered a world where her options would be limited from birth, not because of her abilities, not because of her intelligence, but because of geography and circumstance. In 1903, when Mabel was 13 years old, she and her mother Pauline left Barbados for New York City. Her father Thomas would join them later. They settled in Harlem, a neighborhood that was transforming into the cultural and political center of Black America. Mabel attended New York public schools, but her path forward wasn't clear. For a black woman in early 20th century America, professional opportunities were severely restricted. Teaching was one option, domestic work was another. But Mabel had different plans. In 1914, at age 24, she moved to Washington, D.C. to attend Freedman's Hospital School of Nursing, one of the few nursing schools in America that accepted black students. 3 years later, in 1917, Mabel Doyle graduated with honors. That same year, she married James Max Keaton and became an American citizen. She was now Mabel Keaton, a registered nurse in a country that barely acknowledged black nurses existed. The American Nurses Association didn't accept black members. Most hospitals wouldn't hire black nurses, and when they did, it was only to care for black patients in segregated wards. Mabel Keaton began her career like most nurses of her era, working as a private duty nurse. She went from home to home, caring for individual patients who could afford private care. But working in people's homes, she saw something that haunted her. In Harlem, black families were dying from tuberculosis at alarming rates. The disease ravaged black communities, while white hospitals refused to treat black patients. Black doctors were denied privileges at most medical facilities, and there was nowhere for black tuberculosis patients to receive the long-term inpatient care they desperately needed. In 1920, Mabel Keaton did something about it. Working with black physicians Louis T. Wright and James Wilson, she helped establish the Booker T. Washington Sanatorium. It was the first inpatient center in Harlem for black tuberculosis patients. More importantly, it was one of the few facilities in New York City where black doctors could actually practice medicine. Mabel served as superintendent of the sanatorium from 1920 to 1922. During this time, she conducted a comprehensive survey of health conditions in Harlem. What she found was devastating. Black families faced higher rates of every major disease. Infant mortality in black neighborhoods was double that of white neighborhoods, and the health care available to black communities was woefully inadequate. But Mabel's survey did more than document problems. It led to the creation of the Harlem Committee of the New York Tuberculosis and Health Association. Mabel became the committee's first executive secretary, a position she would hold for 12 years. In 1931, Mabel married Fritz C. Staupers. She was now Mabel Keaton Staupers, and her work was about to take on national significance. In 1934, the National Association of Colored Graduate Nurses made a decision that would change American nursing forever. They elected Estelle Massey Riddle as president and hired Mabel Staupers as their first paid executive secretary. The National Association of Colored Graduate Nurses, known as the NACGN, had been founded in 1908 by black nurses who were excluded from the American Nurses Association. For decades, it had operated on a shoestring budget, run by volunteers fighting for recognition in a profession that didn't want them. But in 1934, with support from other black organizations and private philanthropists, the NACGN moved into new headquarters in the Rockefeller complex on West 51st Street in Manhattan. They were positioned alongside other prominent black health organizations, and they finally had the resources to launch a sustained campaign for equality. Mabel Staupers understood that her fight wasn't just about access to professional organizations. It was about life and death. Black nurses couldn't get the training they needed because most nursing schools rejected black applicants. Those who did graduate couldn't find jobs because hospitals wouldn't hire them. and black patients suffered because there weren't enough black medical professionals to care for them in a segregated healthcare system. Throughout the 1930s, Mabel worked methodically to chip away at these barriers. She lobbied nursing schools to accept black students. She pushed hospitals to hire black nurses. She testified before state and local governments about discriminatory practices in healthcare. The work was slow, exhausting, and often discouraging. But Mabel Staupers had something that her opponents didn't expect: patience matched with strategic brilliance. Then came December 7th, 1941, Pearl Harbor. America entered World War II, and suddenly everything changed. The military needed nurses desperately. Battlefield casualties required massive medical support. The Army Nurse Corps, which had consisted of less than 1,000 nurses in 1940, needed to expand to tens of thousands. Black nurses across America saw an opportunity. This was their chance to serve their country and prove their worth as medical professionals. Thousands of black nurses filled out applications for the Army Nurse Corps. They had the same training as white nurses. They had passed the same board examinations. They met every requirement for military service. And they received letters telling them that their applications would not be considered because the Army did not have regulations in place for the appointment of black nurses. The Navy Nurse Corps didn't even pretend to have a policy. They simply refused to accept black nurses at all. The United States was at war with fascism, with Hitler's ideology of racial supremacy. American propaganda emphasized democracy and freedom. But the American military was telling qualified black nurses that they couldn't serve their country because of their race. Mabel Staupers immediately began lobbying for change. She met with Army officials. She testified before government committees. She wrote letters to newspapers. She contacted members of Congress. The pressure worked, but only partially. On October 25, 1940, Surgeon General James C. McGee announced that the War Department would admit black nurses to the Army Nurse Corps. But there was a catch, a quota. The Army would accept exactly 56 black nurses, just 56, in an Army Nurse Corps that was rapidly expanding toward tens of thousands of members. The justification was cynical and circular. Army officials argued that black nurses could only care for black troops in segregated black wards. Since there were limited positions for black nurses, the Army claimed it only needed a small number of them. The policy created its own justification. And what about those 56 black nurses who were accepted? Where did the Army send them? Fort Bragg, North Carolina, Camp Livingston, Louisiana, Deep South military bases where segregation was enforced brutally. These nurses lived in colored barracks. They ate in segregated dining halls. They worked in segregated hospitals, and they could only treat black soldiers, even as white nurses were overwhelmed with casualties from all backgrounds. Mabel Staupers understood immediately what this quota meant. It was tokenism dressed up as progress. The Army could claim it had integrated its nurse corps while actually maintaining segregation. Worse, the quota system made it nearly impossible for black nurses to prove their capabilities. With only 56 positions available across the entire Army, most black nurses would never get the chance to serve at all. But Mabel had learned something crucial during her years organizing in Harlem. Change required more than just being right. It required building coalitions, gathering evidence, and waiting for the right moment to strike. So she began collecting stories, letters from black nurses describing their rejections, documentation of qualified professionals being turned away while the Army claimed it needed more nurses, testimonies about the conditions black nurses faced in segregated military facilities. By 1943, the Army had raised its quota to 160 black nurses. The number sounds like progress until you realize that by this point, roughly 6,000 white nurses were serving on active duty. The Army was still limiting black nurses to less than 3% of the force, and only because the original quota of 56 had become indefensible. Then the assignments got even more insulting. Black nurses began receiving orders to care for German prisoners of war, POW camps. The army was sending black nurses to provide medical care for captured Nazi soldiers while rejecting thousands of black nurses who wanted to care for American troops. At Camp Florence, Arizona, at facilities throughout the South, at POW hospitals in England, black nurses found themselves treating enemy combatants. For many black nurses, this was the ultimate betrayal. It had taken decades of fighting just to be admitted into the Army Nurse Corps. They had volunteered to serve their country. They wanted to save American soldiers' lives. Instead, the army assigned them to care for men who had been fighting for Hitler's racist ideology. One nurse filed a formal complaint in August 1944 after a German POW at Camp Papago Park declared he hated black people directly to her face. The commanding officer issued no punishment. The nurse wrote to Mabel Staupers, "That is the worst insult an army officer should ever have to take. I think it is insult enough to be here taking care of them when we volunteered to come into the army to nurse military personnel. All of this is making us very bitter." Mabel Staupers filed every letter. She documented every injustice, and she kept lobbying, even as the numbers remained shamefully low. By the end of 1944, only 247 black nurses were serving in an Army Nurse Corps that had grown to over 40,000 members. Meanwhile, approximately 9,000 registered black nurses had applications pending with the Army Nurse Corps. 9,000 qualified professionals waiting to serve, being rejected while the Army claimed it faced a nursing crisis. Then, in late 1944, Mabel Staupers learned something that changed her strategy entirely. The War Department was considering instituting a draft for nurses. For the first time in American history, women would be subject to conscription for military service. The situation in Europe had become dire. The D-Day invasion, the fighting through France, the Battle of the Bulge, casualties were overwhelming military medical facilities. Surgeon General Norman T. Kirk claimed the Army needed 18,000 additional nurses immediately, or medical care for wounded soldiers would suffer. Mabel Staupers saw the hypocrisy instantly. The Army was considering drafting white women into nursing service, while 9,000 qualified black nurses sat idle, their applications rejected or delayed. This wasn't just discrimination anymore. This was the perfect moment to force America to confront the contradiction at the heart of its war effort. But Mabel knew she needed allies. She needed someone with the power to make the military establishment listen. So she reached out to Anna Arnold Hedgeman, a civil rights leader with connections to the Roosevelt administration. Hedgeman managed to arrange something extraordinary: a meeting between Mabel Staupers and First Lady Eleanor Roosevelt. On November 3, 1944, Mabel Staupers walked into Eleanor Roosevelt's apartment in Washington Square, New York City. Before the meeting, Mabel had sent Roosevelt letters from black nurses detailing their experiences with segregation and discrimination. Now she had 30 minutes to make her case to one of the most influential women in America. Mabel laid out the situation systematically. She talked about the quota system that limited black nurses to a tiny fraction of the Army Nurse Corps. She described black nurses being assigned to care for German POWs while American soldiers went without adequate medical care. She explained how the Army had assigned 82 black nurses to serve just 150 patients at the exclusively black station hospital at Fort Huachuca, Arizona, a massive oversupply in one location while claiming it didn't need black nurses elsewhere. She detailed the delays, the rejections, the 9,000 black nurses ready to serve, but being turned away. Eleanor Roosevelt listened. She asked questions. And Mabel Staupers later wrote that Mrs. Roosevelt listened and asked the kind of questions that revealed her keen mind and her understanding of the problems. Within days, conditions began improving for black nurses serving in POW camps. Some were transferred to facilities in California where they were treated better. Mabel Staupers was convinced this was Eleanor Roosevelt's influence. But the real fight was just beginning. In early January 1945, the War Department scheduled an emergency recruitment meeting in New York City. Surgeon General Norman T. Kirk would address 300 nurses, politicians, and private citizens about the nursing crisis. He was expected to formally announce support for drafting women into the nurse corps. Mabel Staupers attended that meeting. She sat in the audience as Surgeon General Kirk described the desperate need for nurses. He talked about the wounded soldiers. He discussed the strain on medical facilities. He explained why a draft might be necessary. And then Mabel Staupers stood up, in front of 300 people, in front of the Surgeon General of the United States Army. Mabel Staupers asked a simple question. If nurses are needed so desperately, why isn't the Army using colored nurses? The room fell silent. Kirk had no good answer. Everyone present understood what Mabel Staupers was pointing out. The Army was considering the unprecedented step of drafting women, forcing them into military service against their will, while simultaneously rejecting thousands of willing, qualified black nurses. The hypocrisy was indefensible. Days later, President Franklin D. Roosevelt delivered his State of the Union address on January 6, 1945. He urged Congress to amend the Selective Service Act to include the induction of nurses into the armed forces. The President of the United States was publicly calling for a nursing draft, while 9,000 black nurses sat, waiting for their applications to be processed. Mabel Staupers didn't waste a moment. She had spent years building relationships with civil rights organizations, women's groups, and labor unions. Now she activated every connection she had. She asked everyone sympathetic to the cause of black nurses to send telegrams directly to President Roosevelt, demanding that black nurses be included in any draft legislation. The response was overwhelming. The NAACP sent telegrams. The ACLU sent telegrams. The National YWCA, the Catholic Interracial Council, the National Nursing Council for War Services, the American Federation of Labor, organizations across the political spectrum rallied behind Mabel Staupers and the National Association of Colored Graduate Nurses. Newspapers published editorials. Radio programs discussed the issue. The question spread across America. How can the military draft nurses while rejecting thousands of qualified black nurses? Congressman Adam Clayton Powell, Jr., the charismatic representative from Harlem and one of only 2 black members of Congress, took the fight to the House of Representatives. On March 7, 1945, as the nursing draft legislation was being debated, Powell delivered a speech that laid bare the moral bankruptcy of the military's position. It is absolutely unbelievable that in times like these, when the world is going forward, that there are leaders in our American life who are going backward. It is further unbelievable that these leaders have become so blindly and unreasonably un-American that they have forced our wounded men to face the tragedy of death rather than allow trained nurses to aid, because these nurses' skins happen to be of a different color. The public outcry became impossible to ignore. The military's position wasn't just discriminatory, it was actively harming American soldiers. Wounded servicemen were suffering from inadequate medical care, while qualified nurses were being rejected because of their race. The contradiction was too blatant, the hypocrisy too obvious. On January 20th, 1945, just 14 days after President Roosevelt's State of the Union address, Surgeon General Norman T. Kirk made an announcement that would change military policy forever. The War Department would accept every Negro nurse who puts in an application and meets the requirements. The quota was eliminated. No more limits based on race. Black nurses would be accepted into the Army Nurse Corps without restriction. 5 days later, the Navy followed. Rear Admiral W.J.C. Agnew announced that the Navy Nurse Corps would also accept black nurses. For the first time in American history, both the Army and Navy would accept qualified nurses regardless of race. The nursing draft never happened. By June 1945, voluntary enlistment had filled the military's nursing needs. The crisis that Surgeon General Kirk had declared, the shortage so desperate it required drafting women, was resolved without forcing anyone into service. And it was resolved in part because the military finally started accepting the thousands of black nurses who had been trying to serve all along. When the war ended in September 1945, 479 black nurses were serving in a nurse corps of 50,000. That number might seem small, but it represented something revolutionary. For the first time since World War I, black nurses were serving in the United States military without quotas or racial restrictions. The door had been opened. The precedent had been set. But Mabel Staupers understood that the fight wasn't over. The military had eliminated quotas, but what about the nursing profession itself? The American Nurses Association still didn't accept black members. Most nursing schools still rejected black students. Hospitals still maintained segregated facilities. Military integration was just the first step. So Mabel Staupers kept pushing. She continued her work with the National Association of Colored Graduate Nurses, lobbying the American Nurses Association to drop its racial barriers. She testified before medical boards. She met with hospital administrators. She documented discrimination in nursing education and employment. And slowly, painfully, the walls began to crack. In 1948, 3 years after the military integrated its nurse corps, the American Nurses Association finally opened its membership to nurses of all races. It had taken decades of organizing, lobbying, and persistent pressure. But the largest professional nursing organization in America finally acknowledged that black nurses belonged in the profession. Mabel Staupers looked at this victory and made a decision that surprised many people. In 1949, she became president of the National Association of Colored Graduate Nurses, and then she led the organization in a vote to dissolve itself. The NACGN had been founded in 1908 specifically to support black nurses who were excluded from mainstream nursing organizations. For over 40 years, it had fought for integration and equal treatment. Now, with the American Nurses Association finally accepting black members, Mabel Staupers argued that the NACGN had fulfilled its purpose. Not everyone agreed with this decision. Some argued that black nurses still faced discrimination and needed their own organization for support. But Mabel Staupers believed that maintaining a separate organization would undermine the goal of full integration. If black nurses were going to be equal members of the nursing profession, they needed to be active in the same organizations as white nurses, sitting at the same tables, making the same decisions. The NACGN officially dissolved in 1951. That same year, the NAACP awarded Mabel Staupers the Spingarn Medal, its highest honor, for her work toward racial justice in the nursing profession. The award was presented by Lillian Smith, author of the anti-racism novel Strange Fruit. In her acceptance speech, Mabel reflected on what had been accomplished. Black nurses had won the right to serve in the military without quotas. They had gained admission to the American Nurses Association, but she was clear-eyed about what remained to be done. True equality in nursing and in American healthcare would require continued vigilance and effort. In 1961, at age 71, Mabel Staupers published No Time for Prejudice, a story of the integration of Negroes in nursing in the United States. The book documented her decades-long fight against discrimination in nursing, from establishing the Booker T. Washington Sanatorium in 1920 to eliminating military nursing quotas in 1945 to integrating the American Nurses Association in 1948. It was a first-hand account of how change happens, not through dramatic moments, but through years of persistent organizing, strategic coalition building, and refusing to accept injustice. Mabel Staupers continued practicing nursing and remained active in healthcare advocacy for decades. She watched as the profession she had fought to integrate slowly became more diverse. She saw black nurses take on leadership roles in hospitals and nursing schools. She witnessed the gradual dismantling of segregation in American health care. On November 29, 1989, Mabel Keaton Staupers died of pneumonia at her home in Washington, D.C. She was 99 years old. Her death barely made the news. There were no major obituaries in national newspapers, no extensive coverage of her extraordinary life. She had changed American military policy, integrated a major profession, and saved countless lives. But like so many civil rights pioneers, especially women, Mabel Staupers died in relative obscurity. The story of Mabel Staupers matters because it reveals how change actually happens in America. It's not usually dramatic. It's not often the result of a single heroic act. Real change comes from people like Mabel Staupers, who spend decades doing unglamorous work, collecting documentation, building coalitions, lobbying officials, waiting for the right moment to act. When that moment came in January 1945, Mabel Staupers was ready. She had the evidence. She had the connections. She had the strategy. And she had the courage to stand up in a room full of military and government officials and ask a question that exposed a hypocrisy at the heart of America's war effort. If nurses are needed so desperately, why isn't the Army using colored nurses? That question, and the campaign that followed, forced the United States military to confront its own racism in the middle of a war against fascism. It revealed that fighting for equality often means forcing institutions to live up to their own stated values. The military claimed it fought for democracy and freedom. Mabel Staupers simply held them to those principles. Her victory had effects that rippled far beyond nursing. When President Truman desegregated the entire U.S. military in 1948, he was building on precedents set by people like Mabel Staupers. The elimination of nursing quotas in 1945 demonstrated that integration could work, that black professionals could serve alongside white professionals without destroying unit cohesion or military effectiveness. Today, the Army Nurse Corps is fully integrated. Black nurses serve at every level of the military medical system. The American Nurses Association actively promotes diversity in nursing. Nursing schools across America welcome students of all backgrounds. These changes didn't happen automatically. They happened because Mabel Keaton Staupers spent decades fighting for them. Think about what Mabel Staupers accomplished with just 30 minutes with Eleanor Roosevelt, one confrontation with a Surgeon General, and a well-coordinated telegram campaign. She didn't have social media. She didn't have television appearances. She had typewriters, telephones, and the organizational infrastructure she'd spent years building. She had relationships with civil rights leaders, women's organizations, and labor unions. And when the moment came, she knew exactly how to use those relationships to create pressure that the military couldn't ignore. Mabel Staupers understood something crucial about fighting injustice. Being right isn't enough. You also have to be strategic. She could have spent years arguing that discrimination was wrong, that qualified black nurses deserved to serve their country. Instead, she waited until the Army's own desperation exposed the absurdity of its position. When the military claimed it needed nurses so badly it might draft women, Mabel Staupers pointed out the 9,000 qualified black nurses the Army was rejecting. The contradiction was indefensible. This is what made Mabel Staupers so effective. She didn't just advocate for black nurses. She forced institutions to confront their own hypocrisy. The United States was fighting a war against Hitler's racial ideology, while enforcing racial segregation in its own military. The Army was considering drafting women into service, while rejecting thousands of willing volunteers because of their race. These contradictions became impossible to defend once Mabel Staupers brought them into the public eye. The elimination of nursing quotas in January 1945 wasn't just about nursing. It was about forcing America to live up to its own ideals. It was about demonstrating that integration could work. It was about proving that black professionals could serve alongside white professionals with equal competence and dedication. Every barrier Mabel Staupers helped break down in nursing made it harder to justify similar barriers in other fields. When Mabel Staupers died in 1989, the world had changed in ways she had directly influenced. The military was integrated. The nursing profession was integrated. Black nurses worked in hospitals across America, held leadership positions in professional organizations, and taught in nursing schools. These changes weren't inevitable. They happened because Mabel Staupers refused to accept discrimination, built the organizational infrastructure to fight it, and waited for the perfect moment to strike. Mabel Keaton Staupers never commanded armies. She never held elected office. She never became a household name. But she changed America in ways that most politicians and generals never could. She did it one confrontation at a time, one letter at a time, one coalition at a time. She did it with patience and strategy and an absolute refusal to accept injustice. Her weapon was a simple question, asked at precisely the right moment. If nurses are needed so desperately, why isn't the Army using colored nurses? That question exposed a contradiction the United States military couldn't defend, and 14 days later, the policy changed forever.